So, welcome again. This is the 4th annual Virginia Clinicians for Climate Action Education Summit. And for those of you who are new to, I saw this on a video the other day, and I don't know why it kept happening. It happened to somebody else. But in any case, welcome. And I'm going to do a brief introduction of VCCA and share my screen. Let me know if those of you at home can see this. Thumbs up if you can see. Pardon? Thumbs up? Okay, good. Right here. Okay. You know, we're here because climate change is the biggest global threat, health threat of the 21st century, and we're all sorts of different professionals involved in health. This is from the Lancet almost exactly 15 years ago today. So this weekend, they published this, and they keep publishing the same comments yearly. The Virginia Climate and Health Education Collaborative, as I said, started 4 years ago. In our first, it was established in 2021 to introduce climate education into the curriculum of the schools, of health schools in the Commonwealth of Virginia. And we've had good success. We've done a number of schools. We keep wanting to expand more, and some schools are going on their own, but we're here to help provide resources to that. And again, future doctors, nurses, pharmacists, and other allied health professionals have to be prepared to recognize, diagnose, and treat climate health-related conditions if they're adequately able to care for these people in our changing world. And again, feel free to ask questions, interrupt, or this is a pretty small group and informal. And again, VCHEC is a collaborative of healthcare trainees, faculty, academic administrators, and practicing clinicians who understand the need to incorporate climate education into the schools of health training. And so that's what our goal and purpose is. And we're a part of VCCA. And I actually didn't have that first slide, so I'll go back to that. This collaborative provides support, resource sharing, and inspiration to help trainees to ensure they are prepared for the future. And I forgot our biggest, VCCA was formed by Samantha Dude in 2017. John has been our executive director for a long time. Homan was one of the original joiners. I joined a year or so later. But because this is, as I talked about, it's the biggest global health threat of the 21st century. And this is part of our group. We have an advocacy day in Richmond where this was from last year, but we have clinicians, students go down to talk to our lobbyists about what we can do in Virginia. So in addition to our role of education, we also value advocacy as a tool. So again, that's any questions, any thoughts? Well, and again, welcome.
Okay. Right. Thank you, everyone. So I realizing the slides may not be advancing on for those of you guys that are here virtually. So I'm going to try to do that one more time. And I think we should be there. Let me know if you guys can see that. Do you guys see it advancing? Thumbs up. Yeah.
Yes.
All right. So we have a couple of speakers today. Actually, 1 second. Right. I don't know if this is the updated slideshow. Do you guys have the one where I had the agenda emailed in this morning.
That would get sent this morning.
Yeah, no worries. But I'm going to go ahead and we'll put up the agenda in just a little bit, but I think the overall for today, what we want to do is to get together and have a couple of speakers that are from educators from New Jersey. They're going to talk to us about what they have done in the curriculum up in their respective medical schools, and then from there, we're going to break into smaller groups and have our student leaders and other leaders from different health professional schools talk about what they have done and the challenges and successes that we have in different programs. We're going to have lunch, and we're actually there's a slight change of schedule from the original, and again, we'll put that up in just a bit. But we're hoping to have a discussion about nutrition and its role in medical education, and also how that relates to climate and health. So we're going to shift that around a little bit and have it go right at 11 o'clock after our keynote speakers. And then we'll finish up with some more discussions after lunchtime. And we should be done at about 2 o'clock this afternoon. So I'm going to go ahead and introduce my speakers, and I'll introduce both. Actually, let me just make sure if Dr. Saseo, yep, you're on as well. So I'm going to go ahead and introduce both at the same time, and then I'll make sure that there's updated shared screen sharing privileges so you can share your respective slides. But I'm here to introduce Dr. Elizabeth Lisa Saseo. She's an associate professor of medicine at Cooper Medical School of Rowan University and a teaching fellow to their Academy of Master Educators. She's the Director of Medical Humanities and the Director of Climate Health, and she serves as the Associate Program Director of Internal Medicine. Dr. Saseo earned her medical degree at the UMDNJ Robert Wood Johnson Medical School, where she was elected the Angelo T. Angelides Award for academic excellence in medicine and the Alpha Omega Honor Society. She completed her internal medicine training at University of Pennsylvania Health System, and she's a fellow of the American College of Physicians and the Society of Hospital Medicine, where she's the creator and editor of a faculty development resource, which is titled Clinical Quick Talks. Dr. Saseo spearheads the Wellness Initiative for Graduate Medical Education and runs a Climate Health, Art of Science, and Medicine Grants. She's a faculty advisor for the CMSRU Green Team, and she's the chair of Wellness and of Health and Public Policy at the ACP New Jersey chapter. In that role, she's been advocating for sustainability efforts for the healthcare system by creating a task force for healthcare sustainability. And they actually published a report titled Sustainability's Initiative to Guide Healthcare Transformation, which forms a roadmap for greening healthcare. I also have the pleasure of introducing Dr. Catherine Chen. Dr. Chen is an assistant professor at the Robert Wood Johnson Medical School in the Division of General Internal Medicine. She is dual trained in internal medicine and family medicine at EVMS, not too far from here in Norfolk. She obtained her medical degree from St. George's University School of Medicine in Grenada, and she practices as an academic hospitalist, and she's a member of the Society of Hospital Medicine. Her expertise and interests include environmental sustainability in healthcare, quality and safety, and medical education. And she advocates for the provision of high-value, quality, and environmentally sustainable healthcare. Dr. Chen is a member of the Office of Climate Action and the faculty lead for the Rutgers Biomedical and Health Sciences Climate Action Working. This is part of Robert Wood Johnson Medical School's involvement in a global consortium on climate health education, or otherwise known as VCCHE. And Dr. Chen leads the integration of climate and planetary health into the medical school curriculum. So with that, I'm going to stop sharing my slideshow. And I'm going to just make sure that sharing privileges are there. So we should be, Dr. Chen and Dr. Saseo, you should be able to share your slides when you need to.
All
right, well, awesome to virtually present back in Virginia. I think I'm slated to go first, and then I'll just talk about kind of what we've been doing at Robert Wood. And then I'll pass it over to Lisa, who will talk about her work at Cooper and beyond. So can you see my screen? It should say evolution.
Okay, thank you.
Not yet, or yes? Sorry. Yes, okay, great. So this is kind of like an overview of what I've been doing at Robert Wood and kind of the approach that we've been taking to integrating more planetary health into our curriculum. It really was foundational with the Planetary Health Report Card Initiative and all the student efforts that have been happening. I really couldn't do any of this without the students. So we talk at our institution as a pretty new topic, and it's really not been ingrained in our psyche yet. So I usually start with discussing how it's an evolution from the biomedical model, the biopsychosocial model, really to broadening our perspective on how our environment, the animals and plants around us really impact our health. So starting from this Planetary Health Report Card with our student team, we got a resounding D in the planetary health curriculum. So took a kind of broader approach to narrow topics down into kind of 3 pillars of action. So the climate health impacts, the clinical practice and climate adaptation components of that, I kind of lumped into one. Then there's a health equity and environmental justice component and the healthcare waste and systems based care components. So in the beginning of the year or beginning of medical school, we hoped to integrate more of the climate health impacts, the pathophysiology of climate health into their systems-based program, and then talk more about, as they're trying to learn how to take a history, how to develop also environmental health interviewing skills and discuss climate risks with patients. The next component in the clerkship years is discussing the climate impacts and how to identify treatment opportunities, health equity concepts in the clerkships as well, and think about high value care and sustainable healthcare delivery as a part of their continuing progress through medical school. What it really looks like in practice right now is that they start with kind of a walking tour of New Brunswick, where our school is, to look at our areas of flooding, which in EVMS, I remember walking, wading around the little tide pools. So, this is a kind of easy thing for us to kind of identify areas where our patients maybe have access issues to their grocery store or to their clinic because the flood comes like right up to the back of the door. And so, thinking about how we can show students that it's practical and that our patients are affected by it every day. We also think about, so there's also the beginning of our health equity thread and our health system science threads there. So we talk, we're going to integrate this year more discussion about healthcare access, and also our healthcare equity or health equity director has been integrating redlining into her discussions as well. We have I put a yellow dot for the one-off session. So there's a one-off environmental health and particulate matter that needs renewal every year. So that's not a sustained curriculum. So based on how Planetary Health Report Card, as many of you may know, that you have to identify whether this is a core curriculum, whether it's an elective option, or if it's a kind of once a semester or once a year kind of event. And then in the M2 year, they get a overview of like systems-based climate health education. We really haven't been able to get the environmental health and occupational health as a core part of our history taking yet, but that is something that we will work on. And many of you are familiar with this kind of framework from the CDC about rising temperatures, sea levels, and extreme weather. And so we use this as a kind of discussion point for our faculty to say whether they can identify something that is in their pre-clerkship courses or even in their clerkship lecture series and integrate something from that. We have started to integrate more of this experiential kind of components. So this is a map of New Brunswick, and as a part of their walking tour, they get to identify like where flooding happens and like how the heat map looks in New Brunswick itself. So urban heat island effect, also the flooding and, you know, green spaces that they can look at as a part of their reflection. And this is just like an example of our healthcare access slide. Where in New Jersey are the hospitals, urgent cares, and other healthcare access points, and how that fits into the map of flooding and different floodplains that we have. There's also another map which overlays the toxic exposures up, like, so that has a picture of all of the brownfields and contaminated sites of New Jersey, of which we're highly industrialized. So there's hundreds of them, and they're all quite near to the public housing and other, you know, affordable housing sites. So that's something that we think about for our students. The clinical years, we've been starting with each of the faculty leads for the clerkships. And so in family medicine, they talk about also the biopsychosocial model and the environment associated with that. For psychiatry, this year they're starting to integrate PTSD and natural disasters, climate change and mental health into their reflections and journal clubs. And then also for neuro, we're looking at stroke risk factors and occupational health risks, and also starting to talk more about disability medicine as well. And emergency medicine fits really well with their heat and extreme heat and cold. Eventually, we're hoping to also talk about the natural disaster preparedness and things like that. The M4s have an option, M3s and M4s have an option of climate health and sustainability elective, which is brand new off the press like 1 month ago. So we shall see how that pans out. And there is a health equity OSCE, but it needs to be revitalized and revised and updated. So that's kind of how we've been planning our years. We talk about heat maps and the extreme weather exposures, so like the billion-dollar weather events and then all the sub-billion-dollar events. Think about our community exposures and how we think about health equity as that progresses as well. In the postgraduate and faculty education, realistically, it should span all the way from GME to CME. We really haven't been able to integrate as much into the clinical practice components that I'd like to see on like health risks and how to discuss it with patients or climate adaptation things yet. But we do have the opportunity to talk about health equity and population health because I squeezed it into the QI curriculum and talk about healthcare delivery and systems there, and also some advocacy. And then for our faculty, there was an all GME grand rounds I did last year, and we do periodic faculty development, just like keep sprinkling it into their thoughts. And so luckily, you know, as with all this, I'll talk about a little bit later, part of the way I've been approaching all the different elective leaders and course directors and fellowship leaders is to see what they're interested in. So for endocrinology, for example, she's really interested in the health equity component of endocrinology and medication access. And so that's kind of the thing that she has taken forward and even into her society. So for the quality improvement components, we talk about this from the UK, the sustainable value care, environmental and social financial impacts as part of the cost of care, and then also the the outcomes for patients and populations as part of the top. And then how to apply it in terms of thinking about the kind of change ideas that we come up with using those frameworks to provide safe, timely, effective, efficient, equitable, and patient-centered care. We talk a little bit about healthcare waste and how it generates 8 to 10% of the country's CO2 emissions, and that the US is disproportional in how much we produce, and think about ways to streamline process. When we talk about streamlining processes and stuff like that, we integrate a bit of that discussion. And then I always mention the Medical Society Consortium and being involved in whatever specialty they go into or primary care, like they can still stay involved in climate health and healthcare discussions. This is something that we think about a lot because not as faculty members, we were not really taught this in medical school. And so really isn't something that people are comfortable discussing as a matter of like expertise. But normalizing how we can learn together, or having the students kind of, bring in the background research, is part of how we like keep our we learn together and can kind of keep raising the bar for this. This is an example of something from a high value care component that it's how I talk to the students about how to discuss climate change and health effects with their patients. This was like a one-off lecture, so I didn't even really count it, but this is something that they can use to understand the benefits, harms, and relative risks, and then talk about, either customizing care plans for the patients based on their personal risk or concerns, and then identifying opportunities for change. So I use the Tharani and Walpole kind of objectives list. So it's broken down into 3 parts. This is from Medical Education Online by Tharani at UCSF. So the first part is doctor, a scholar, and scientist. And what I ask the faculty to do is, and the students who help me, is to try and anything that they propose should be mapped back to one of these objectives. So in this case, describing how environment and health interact at different levels. The next subset of this is doctors as practitioners, and thinking about environmental sustainability of health systems. And then the last one is doctors as professionals, and thinking about the organization of health and how we can think about local and global environment as components of health, and like the ethos of that. This is from the 12 Tips for Teaching Environmental Sustainability and Health. So I showed this at the GME session, but essentially trying to find for each of our faculty or for each of the students, like what they're interested in, why they would want to learn about this, and how we can help collaboratively develop materials to make it into their course work, right? So a lot of the barriers that we think about is that from a curriculum standpoint, we say, oh, there's no time in the curriculum. Well, yes, that's probably true. There is a lot to learn, but having students identify also, one of the deans who's my mentor asked, like, okay, maybe we should have the students identify areas for cutting. So students having just gone through the program or haven't taken their steps, like, this is probably something that's, should be retired out of our curriculum. Also these micro integrations of sprinkling it here in, they see it, a lecture of it, of health equity and redlining, they see a little bit of it in the health system science, they then see it in emergency medicine. And so carrying that theme through makes it seem like, okay, no matter what specialty you go into, there is something in climate health for you. And then small extensions of existing curriculum. So if you're going to talk about asthma, you can talk about pollutants and environmental change. If you're going to talk about endocrinology, you can talk about insulin and hypoglycemia in extreme heat. So thinking about how we can use educators' knowledge as well. So leveraging, all the things that they do know about their own practice, and then just saying, hey, well, as a small extension, this is what we can do. And then our student energy has really been key. What I ask them to do is usually take the objectives list, go through it, and if they're doing, for example, the neuro block, identify top 10 things in neuro and climate health that they would want to address, with some in the climate health component, some in the, like 1 or 2 in the equity component, and then a few in the in like a climate adaptation component. And then so they will kind of look up references and draft up a document to propose to our clerkship directors. And then, we can kind of like negotiate, like, okay, do you need a practice-based learning module? Would you like a multiple choice question, or would you like a case-based learning thing? Like, what works for you? And then, yeah, so kind of negotiating it director by director. If there is like a lack of student engagement, one of my colleagues proposed to name it. So to say, hey, call it a distinction in climate health and environmental sustainability. So our school is gonna, we're proposing next week actually, to create a distinction called the distinction of in climate health and environmental sustainability. So that our students can get an official stamp of school approval for this. Other places have called it like the scholar, like climate health scholar, planetary health scholar, something to give it a little bit more like of a bang and a recognition for the students. And then last but not least, I'd just like to put a plug out there that on the planetary health report card, if you're filling it out and your director of your planetary health report card does not have FTE, it doesn't count. Just saying. That is probably approved by Cecilia Sorensen, who runs the VCCA. So just putting that out there. And then a message of hope in medicine and career development. And this is what I tell students, that there are pluripotent agents of change, that there are any number of things that they can get involved in, and that, to take something that they're interested in, whether it's going to be in their field or like slightly outside of it, it really doesn't matter, but just to get involved and get stuck in. And this is from the Climate Council, from Healthcare Without Harm, at the 10 different kind of components of change, and how we can imagine healthcare in the future. That's me. Thanks. And I'll turn it over to Lisa.
Hi, thank you so much, Dr. Chen. That was a very enlightening talk. I know I learned stuff from that as well. I'm going to share my slides. I have to say, I am not as much of an IT wizard as Dr. Chen is. They're going to be a little bit more old school. Let me just move this over here for 1 second. Try to blow this up so you can all see it. And thank you, Dr. Y, for the introduction. As he had mentioned, I am now Director of Climate Health at our medical school at Cooper Medical School of Rowan University. But that was a hard-won position. So I'll try to give you a little bit of the history behind that and how you could potentially attain that or something similar at your own medical school. So I have continually tried to frame this when I educate our medical school faculty and also on the health systems side, recognizing that often there are different constituents on both sides of the street, that we really have to focus on the patients continually throughout this process, and that we can't have healthy people if we have a sick planet. Now, at our medical school, we have historically focused on social and societal justice and health equity. So when I first started pitching this, I was trying to think about those elements of our medical school that would really resonate with people. And so for me, pitching this as an environmental justice concern was very synergistic with a lot of the work that we were already doing. And along with that, advocacy. So many of our students come to this school because they're interested in working with underserved populations. They're interested in advocacy. So highlighting all of those areas of interdigitation, how that this work can go alongside other aspects of advocacy. And then research. So Dr. Chen and I have had the opportunity to do research together, and we've continually been pulling in medical students. So all medical schools want to see research happening. So if you show that this is a burgeoning field that medical students can get involved in, people will be excited and they'll see the value in it. A lot of this is really, demonstrating the value over and over again, because it does kind of unfortunately come down to dollars and cents and also time in the curriculum. And then student demand. So, we had a very vocal group of students who were really interested. So, being very supportive of that small cadre of students and really helping them to help you elevate the cause to deans on the medical school side and within the hospital setting. And then, as you keep on presenting this, as I was presenting this over and over again, people will get the sense that there's the writing on the wall and that this is going to happen. And so it's better to stay ahead of the curve rather than be the last one. And that's kind of, we're jumping to the last one, that the peer pressure comes into play as well, because, no one wants to be behind their neighbor. We'll look at health systems across the river in Philadelphia and say, oh, we want to be ahead of them. So there's that little bit of competition that it can be very helpful if you actually kind of place some health systems against each other in that sense. You have to get a little bit political. And then philanthropic funding, other grant opportunities. I think when people see that there's philanthropy behind some of these, there are systems more on the West Coast, but that have funded centers for climate health. Philanthropists are interested in funding some of this work on social justice and health equity. So again, these were some of the mechanisms that I used. Maybe some of these would resonate with you in your medical school. When I do talks to the various different committees, again, I focus on this as a justice issue. This is from Jonathan Patz, and really groundbreaking in this field. I'm sure you've all seen something similar to this. We can see the billions of tons of CO2 are vastly emitted by the global north, whereas the health impacts are impacted by the global south. And then I'll drill down about how this is amplified many times over in our local community. Camden is one of the poorest cities in the country, really. And so our mission at the medical school is really to deal with a lot of those environmental and social injustices. So as I said, this is one angle that I'll often enter the conversation and then pivot to some of the more granular science behind it, so that people know that it's not just me as a tree hugger bringing this in, that there's a depth and breadth of science behind it that can get people excited as well. So I'll usually lay the groundwork. Again, you're trying to show that peer pressure, that there's this force coming, that there's all of these things happening, the dominoes are falling, whether it's the AMA or New England Journal or integration of board questions, and that this is something that they should be paying attention to. I'll usually pull in AAMC, ACGME. Now there's discussion of inclusion as a common program requirement. So pulling in all of these disparate aspects across the medical education continuum. And I know that Dr. Chen already alluded to this research. So only 6% of our students really feel prepared to discuss this. So that usually, we don't want our faculty to, people feel bad when only 6% of people are saying that they're actually ready to do this. And then demonstrating all the other medical schools that already have programs like this. So when I had started presenting some of this, I tried to first integrate into those committees, which I already had a bit of a foothold, and which would meet regularly, and I would be able to present to a large cadre of individuals. So for us, we have a phase 1 committee for the first 2 years and a phase 2 committee for the clinical years. And then we have a curriculum committee, which is kind of overseeing everything at the medical school. So I presented similar, slightly tailored information for all of those groups, since there was some overlap. And then I had several meetings with the dean. So after the first one, a few years ago, we got on the global consortium, as Dr. Chen had alluded to as well. Started doing all of these research projects, clinical studies, medical education studies, systematic reviews. You can see it, we're there on the global consortium. And then as I started doing all of this work in the background, kind of building the case for it, then I was able to get this this director of climate health position. So that's that FTE that we were talking about, which really demonstrates the commitment of CMSRU, and it really helps me to have a bit of a force behind what I'm saying. So when I'm going to a course director and I'm saying, we need to include this, then it's not just coming as, like, oh, Lisa's asking me to do this because it's her pet project. It's like, no, like, the dean has actually committed that I do this work on behalf of the medical school. Sorry, my kids are all in the background. So what happens with the weekend presentation, sorry. So then what we started to do was integrate this into our medical education program objectives. So that's at a higher level than the learning objective, and kind of along the lines of a thread. So we had several focus groups meeting. We had a core group that met probably about 5 or 6 times, and we went through all of the existing medical education program objectives to see where could we potentially interdigitate an environmental or climate focus, and where did we have to create new medical education program objectives, because we did have to create a few new ones. And then we additionally created more learning objectives that would be more at the course or session level. And at the same time, we're trying to think about curricular mapping, because as quickly as we integrate information, it can change 6 months, a year later. So it's also important to be thinking proactively about how you're going to follow up and keep this information fresh. So we have to identify keywords, and working with the Office of Medical Education, we have to begin the process of creating that curricular map, which is, where across the entire medical school curriculum is this content happening. And then we just created last year the scholarly concentrations. So we have several scholarly concentrations now. We have, Sebastian, can you take her? Sorry. I think one of them's going to be here. So there's global health, which there's a lot of interdigitation. There's a racism in medicine scholarly concentration. And then we have other ones on medical education, on ethics, on narrative medicine. There's a little bit less overlap with those, but we've tried to identify where there's areas of overlap, because it is extra work on the faculty. These students do an additional 120 hours of education over the course of their 4 years. For me, I'm accepting right now up to 4 a year. I really wanted to have 2 a year, but then when students are interested and they're applying for it, they do their personal statement, I hate to turn them away. So right now we have 4 a year. And very similar with some of our other scholarly concentrations as well. So it ends up that about a quarter of our class in good academic standing are signed up for a scholarly concentration. And then we started, 2 of my students really took on this project of the planetary health report card. And so, I was a little nervous going into this. It's a wonderful process for any of the schools that haven't done this already. It really gives you a good sense of where things are lacking and areas that you can tackle, and those that might just need a little bit of refinement. So we were very fortunate that we were able to rank 7 here. When my dean saw this, I thought she was going to be really excited. And she's like, wait a minute, there's a C+ on the curriculum slide. And I was like, oh. So hopefully we can bump up that C+ now that I have some FTE allocation to do this. But it does go into a lot of granularity. It goes into, in infectious disease, do you have something there? And for example, I run the selectives in the humanities. So a few years ago, I had created a climate health selective. So that selective, though, only hits 10 to 15 students a year. But that will give you points. So if the content is coming in an elective, that can give you some points. If it's reaching all the students, though, that's obviously going to be your gold standard. So then, I went back and I've been doing even more curriculum committee presentations now. So informing the entire faculty what these MEPOs are, these medical education program objectives, and giving them ideas of how they could potentially integrate. I've given people slides. I've sent journal articles. I've also offered my own services that that I can come in and do 10 minutes, or I can do a complete session to try to make it a little bit easier for people to manage, because certainly not everyone feels totally comfortable with this yet. In the fall, I'm planning to start an evening faculty development session as well. So this would be open to the students and the faculty. And this begins to get at, how can we make it so that it's not just, Catherine and me going around and doing this work? We really need to have many people who are able and facile to do this. So a couple of the other things that we've done within the medicine residency, and again, it's a little bit easier for me because I have a role in program leadership, but we started an internal medicine climate health series. So I have between 8 and 12 lectures that I'll give our IM residents a year. I'll do an intern orientation session. I know, intern orientation is dense. I don't know how much they actually retain from intern orientation, but at least they know that this is an expectation when they come into our residency that we expect them to be addressing this. and grand rounds. So I do our grand rounds for internal medicine. So I will usually put in one session per quarter, if not more. Sometimes that there's a few more stuck in there. And so again, this is coming repeatedly, and it's not just a one and done, which is, I think, really important as you're doing this, that and Dr. Chen had mentioned this too, that micro integration, you don't want it to necessarily be a one-time session. It really needs to be happening. Okay, in a second, baby. It needs to be happening throughout. I worked with our librarians to create a LibGuide. So this is an online library guide. We had created one, well, I didn't create it, but for racism in medicine. And it was really helpful. So I was thinking, how can I help our faculty? And so I created this LibGuide. You can see the breakdown and there was a typo which was fixed now. It's not emergency justice, it's environmental justice. But so, so starting with some videos, because again, like some people have really no familiarity with the subject. And then giving some up-to-date resources that people can refer to. And my hope is that I will record some of the sessions that I'll be doing in the fall for faculty development and put these up here as well. I will say for our racism in medicine LibGuide, our faculty did 5 to 10 minute sessions, which were a little bit more bite-sized, recognizing that everyone's tired. Even though I want to talk for 60 minutes about this stuff, not everyone wants to listen for 60 minutes. So I think I should also probably be doing something that's a little bit more digestible as well. That's down the road. So again, all of this hopefully will be able to improve that planetary health curriculum section. And certainly, some of these are easier to move the needle than others. Things like campus sustainability, obviously, there's a lot of stakeholders that come into play there. And this is just a screenshot of, you can see that there's a lot of detail that you can actually pull from these planetary health report cards. Again, just a couple screenshots. That the sustainability is not only the medical school, but it's also the main campus. It's the hospital. Pretty inclusive. And so these are some examples. So like, for example, for extreme heat, which I know your group has been really very involved in, very impressive. This was covered in elective coursework. So you can see we only got a 1 for that. For something like infectious disease and respiratory conditions, it was in the core curriculum. But then other things where I would have thought that there would have been better inclusion, like, for example, those marginalized populations, again, given our school's interest, actually wasn't there. And the global impacts also wasn't there. And again, that was somewhat surprising. So this is just, and I don't expect people to memorize all of these, but but just so you could kind of see for an example, these were some of our MIPOs and how I went through the process of expanding this out. So for MK3, I just put in, we had already added structural racism from our racism in medicine MIPO process. So I just included environmental justice in there as well. And then you go through, I expanded this out to thread learning objectives, where it could potentially happen. Again, these were just ideas, and then outcome measurements. And so, it could be MCQs, it could be OSCEs, could be something else. So for the end of the medical knowledge, I had to create a new MIPO. So I created one on understanding the pathophysiologic basis, because it felt like a different enough medical education program objective that it should stand alone. And then again, similar things for patient care. I just built in the environmental determinants of health along with the social determinants of health. And similar for some of these other issues. Don't want to bore people with the whole entire thing. I added in again for HP1, added in environmental health, but then for system-based practice, I had to add in a new section because it wasn't completely addressed. So as I had mentioned, the scholarly concentrations going on, the healthcare sustainability work. Several of our medical students have been involved in QI projects involving our hospital's green team. There's a lot of overlap with our racism in medicine group. And Cooper does a ton of community service. We had gotten the AMC Spencer Foreman Award a few years ago in recognition of this. And so this was just kind of a natural alliance with the climate health work. On the moving forward, I am going to be scheduled to present to our chiefs and chairs. So again, this is more socializing the information so that on the health system side, they see that this is important. It was a little late to do it for this year, but next year I'm going to be doing an M3 orientation session, probably just about an hour or so, talking about how they can potentially include this in their history taking. It's already introduced in Foundations of Medical Practice, but just reminding our students as they go in. We have interdisciplinary sessions in the clinical years where all of the students come back together and present on a topic, and just making sure that some of those have a climate health focus. At Cooper, we have a strong military medicine program because of our large trauma unit. So the military team has actually a very robust disaster medicine training. So we've been talking about how could we potentially incorporate ADLS training into this work. We'll keep on working on research, building collaborations within our community, also with the main campus, because they can be very supportive with any resources that they have, especially if there's schools of earth and environment, showing that grant work can, provided the administration doesn't change, hopefully that the grant work will still be possible. And potentially we'll be looking into creating a certificate of climate health that would be outward facing and not just for our internal faculty. And just like thinking outside the box a little bit. So again, this was we did this on Earth Day because I run the humanities, and we have an art course, and we have students who are interested in art. They have an art RX program. We actually did a walking tour in Camden to one of the murals, and we went with the artists who created the murals. And on the walk, and it wasn't far, it was like maybe 10 minutes. We talked about just like walking through much as what Dr. Chen had said, like identifying where are the areas where there's no trees, where is everything landlocked and there's no access to fresh water and things of those nature. So we talked about that on the way over there, and then we talked about this mural from the artist's perspective, and it was just a really very valuable experience. It was very eye-opening also to hear it from the artist, and then it shows to all of those linkages between the arts, the humanities, environment and nature, and what we're trying to do with educating our students and really being sensitive to our patients' needs. So that's all I have. I'm gonna stop sharing, and we're both happy to take any questions.
Being serenaded in the background. I think this is one of the reasons why we are reminded about why we do the work that we do. It's for the future generations that we have. So we actually love that companion soundtrack in the back. What I want to see actually nursing learners of us that are doing a lot of work that we'll hear about, as we do have medical school leaders and educators as well. I guess one of the questions that I have to start with for both is kind of thinking about curriculum integration. What should come first? And certainly it kind of depends on different schools and environments and things like that. But we think about starting an elective first. Is the that we introduced to while I do notice in many other schools, there's a broad integration that starts first, and then the elective comes later. So wanted to hear both your thoughts about that, and kind of, especially Lisa, from your end standpoint of just kind of having some influence and some pull in some of the key committees and how these environments come together.
Sure, I can start and then hand it over to Catherine. So for me, again, I was thinking where I had the most immediate impact at the time. So I've been running the humanities program since 2014. So it was much easier for me to start a climate health selective and get that in right off the bat. Also because I didn't really need anyone's approval to do that. I mean, there are like approval mechanisms. It has to pass the curriculum committee, all that. But so I think, trying to see, maybe you have a colleague who's teaching a course, trying to pull in those favors where you can and get all those low hanging fruit things first. And again, because I run grand rounds, it was easy for me to just start building in grand rounds. So trying to do those easy things also then shows that there's interest, and then you can start to build a little bit of momentum for the harder lift, which is really, getting that FTE, that protected time. And then, like if you can get your dean like a little bit annoyed that like we're not number one, then that kind of like triggers the competitive side, and then it's like, of course. So then when people know, like, well, the dean wants to see this done like this year, like that's amazing. I mean, like I couldn't ask for anything better than that. So I don't know Catherine's thoughts though.
Yeah, so my institutional support is less. And so they have their priorities in other places right now. And so for me, the starting point was, like Lisa said, whatever I could reach, right? What I had influence over. So I actually started with more of the GME side because I run the QI curriculum. So that's kind of where I stuck it in. And then the student energy, that really helped to like bring it to the fore. So we started with the planetary health report card and then presented it to the curriculum committee. And realistically, it was their individual approach to each of the clerkship directors that was our starting point. So I think it depends on if you have institutional support, going with that and a top-down approach and like an organized collaborative approach is probably best. Yeah, but I think for me, I'm the one who keeps it mapped out to the objectives and stuff like that on as like coordinating the different student efforts, and periodically checking in with my dean and asking for FTE episodically. I make it like a biannual like recurring meeting with her. But yeah, hopefully that answers some of the questions.
But that then Catherine can also go and say, well, CMSRU has a full-time position.
Yes.
So then, pulling in the peer pressure.
Yes. I'm going to use that line next time, Lisa. I'm doing it.
I have a question along another line.
Yeah. Can you guys hear the question? Okay.
Here, up to. I'm just curious about if you can provide some examples in terms of research and student research. I teach in the graduate school, and our students are actually doing research, and just some ideas that if you can provide some examples or anything that maybe some students have done in terms of research in the area that might give them and some of the people here ideas. I know I've seen a lot of calls. It's typically can be well funded too, which is nice. So, but I'm not sure how to guide people or where to steer people. So I don't know if you've had many students do research.
Dr. Gray, you're with the School of Nursing.
Yes,
I'm sure.
In school of nursing at Old Dominion University, and I teach in the master's and the doctoral program is probably where the folks will be doing more of the research.
Catherine, do you want to go first, and then
Sure.
I can go?
I have a more limited research palette. So there are two or three different kind of categories that I have right now. So the medical education research, I think, is not very well funded, but that is where a majority of my efforts are. And so currently most of my students are working on med ed projects. So that's like pre-post testing, that's qualitative analysis, that's kind of the so qualitative analysis of like reflections, for example. And So there's that component. And then the other component right now is more of the healthcare waste perspective. So there are people doing waste audits and life cycle analysis. We're trying to develop a system of life cycle analysis in conjunction with pharmacy. So there's the interprofessional components. And so those are kind of like the two main buckets right now that I have for student-based research efforts, both of which are not currently funded. Yeah, Lisa, you have a better.
Yeah, so I can't say that all of my medical student projects are funded, but some of the ones that are not medical or where they're not as much involved have got funding. So there's systematic reviews, which are great to pull in a number of students because you can divide up the work. So we have I think 3 of those actually going on, and all of our students have to do a capstone project. So they have to do something, and ideally have a publication to show at the end of it, or at least an abstract. So so that the students are hungry to get involved with those type of projects. So if you have that requirement, that definitely helps. We also have been doing some medical education work. We I think Dr. Kawani is in the audience, and so so we had done a study together, did some other studies with integrating new coursework, and then also clinical studies. So I started a survey study at our hospital, assessing climate perceptions among our inpatients. Which is multi-center. So if anyone in Virginia wants to get involved, I'm still trying to recruit patients for that. So definitely just like shoot me an email. And then some of the other pieces which I actually I have a couple like big grant applications coming up is at that nexus of environmental justice and health. So and that can involve focus groups, that can involve qualitative surveys, that can also involve other metrics. We've also been doing heat mapping studies. So so I've been working with a group of climatologists, and that's something that our medical students have helped with as well, because you can pull hospital data. We use EPIC, so you can pull EPIC data and look for associations with things like heat, with air pollutants, with things of that nature. Because we're such a large trauma center, looking at admissions for trauma, correlated with different environmental factors. So I mean, those are a few of the things that I'm thinking off the top of my head. But the other thing I should mention is that for clinicians who are busy, it's super helpful to involve PhDs or people on the university side, and really pair up, because they often are interested in having a physician be involved, and we obviously benefit from their expertise, and so it can be a really synergistic relationship.
Thank you.
Thanks, both of you, for the enlightening talks about all this. You both mentioned the planetary health report card and how sort of important that was in spurring sort of competition. And, medical schools have seemed to do that. UVA did the nursing program report card. How is this an ongoing project? Are the students driving it? How did you bring that? Yeah, how did you sustain that? And how did you bring that to the dean's attention? And do you have to have a specific dean who's interested in competition, or?
No, I actually, the beauty is that the medical students can actually, they can do it all on their own. You don't need to have dean approval for it. They just basically audit the curriculum. They submitted that this is an independent body that reviews and adjusts, make sure that all the responses are accurate. And then you get a grade, and it's expected that you do it annually, which is why my dean wants us to change that grade for next year.
Yeah, so our students, so it's a student run entirely, like faculty cannot actually be the drivers for it. So you do need student engagement for it. We skipped our last year, and so I'm rolling it into as a part of the distinction. So every year we have like 4 or 5 students who are really particularly interested. This year they just all chose quality improvement projects. So hopefully next year as a part of the distinction, we can kind of start that rolling again and then make it an annual thing. It does take some time to do because there are 5 different sections and they have to like interview people at the university level to talk about the university sustainability, and the clinical level, they have to have, you talk to a bunch of clinical faculty and perhaps the institution where, like your primary institution for healthcare, because there's a bunch of questions about that. And then they do like the curriculum audit component, which is quite a bit of work because it spans all of their curriculum. So our team was fairly large in doing it the first year. And so I think, a team of like 3 or 4 students is probably good. But I think if one strong enthusiast could do it, but it would probably be best spread amongst others. And my dean was, we just kind of put ourselves on the curriculum committee agenda and was like, this is what we're talking about a little bit today. So there was some engagement with the faculty, like the faculty themselves were interested in the topic, but we're not as competitive as, Cooper.
Vishal, you guys were involved in your planetary health report card at UVA School of Medicine. So raise your hand for our audience down here. So from the, the nursing students, if this is something that you guys would like to take on, I would speak on your behalf that we're likely that you guys can serve as a resource to kind of help guide that process. And we certainly have the UVA School of Medicine planetary health report card published on the national website, and that can always be used as a guidance. So, okay. Any other questions?
I'll just make a note that the process starts sometime in late September or October. So they have like throughout the year, they have little benchmarks and milestones. And then it's like due, I think sometime in February so that it can be published around Earth Day. So just thinking about the timeline for that.
Thank you so much. I would echo with Nick that this has been very enlightening, and it's certainly amazing what this has been able to do, the both of you at your individual institutions, and we certainly all come away with some tips on how to implement with our own respective.
They are sharing their slide.
Yes. There's a scheduled email to be sent out to you guys, basically asking if you mind sharing the slides with us. So as you send it to our email, then we'll publish it on the website.
Happy to. Thank you so much for the
Yeah.
opportunity.
Really appreciate you all.
Thank you so much.